Knock, knock, knock. Hi, my name's Alyssa. I'm gonna be your nurse. Your doctor has ordered you vancomycin, which is an antibiotic for infection, and then he's also ordered you some Zofran. These are just gonna go in your IV site that you already have. I'm going to explain the procedure to my patient, follow my 11 rights of medication administration, and I'm also going to follow all of my general principles and safety practices. Can you tell me your name and date of birth? Okay, and do you have any allergies? Okay, all right. I've already performed hand hygiene when I walked in the door. First thing, I'm going to clamp my tubing. I'm going to take this off and be sure not to touch it. Then I'm going to scrub this hub with an alcohol wipe. I'm also going to assess the IV site for any redness, swelling, drainage. First, I'm going to flush this site with saline, and I'm not going to touch any of this after I've cleaned it. Aspirate, and then flush it with saline. Okay. And every time I reconnect this hub to something, I'm going to clean it vigorously. Okay. Now I'm going to administer the medication. As I'm administering, I'm still checking this IV site. I'm going to push it at the correct rate that is ordered. Again, scrub that up. And then I'm going to flush with another thing of normal saline. And once again, scrub the hub. Then I am going to hook the IV back up. Okay. I'm going to reassess the IV site again for redness, swelling, irritation. How does that feel? It feels okay? Okay. Now we're going to hang the antibiotic that the doctor has ordered for you. This out. I'm going to be sure and not touch this or this. And stick that in there in a downward motion. Get it down in there. I'm gonna make sure my tube is clamped. I'm going to prime this. It's wrapped, sorry. Going to prime this tubing. Make sure my bag is inverted. And I'm going to connect this to the top connector piece. Okay, now I'm going to drop this below this one because the secondary bag goes underneath. I'm going to make sure that my secondary bag is not dripping, and then I'm going to open my primary bag. I'm going to open it up and be sure that it is dripping at the correct drip rate that is ordered by the doctor. And how does that feel? Do you feel okay? Yeah, you feel okay? Okay, great. So after that's hanging at the correct drip rate, I'm going to take my gloves off. I would report and record everything, and I'm going to reevaluate the patient for pain. Then after I do that, I would come back in, perform hand hygiene again, and that was a nice catch. And at this time, the IV solution is empty and the patient has received what the doctor has ordered. So we are going to clamp off. Clamp off the antibiotic bag and dispose of that. And at this time, this can be moved back up here as well. I'm going to put a Kuros cap on here. And I'm going to open up this IV and make sure it's running at the correct drip rate that the doctor has ordered. Make sure my patient is comfortable, free of pain. Make sure to clean up all of my supplies. I would perform hand hygiene, and again, I would report and record and reevaluate for pain.